So I think one of the revolutions in my own medical practice is when I realized that I didn't have to have answers, I just needed the questions. So I think it's, what are you fearful of? Tell me more. Why is that? And I think most people, in my experience, you give them some time to talk through and they come to their own sense of resolution or reconciliation with those emotions. And if they're truly, so this would be in a situation if they truly were paralyzed from my perspective, meaning they're not making decisions that I would think would make sense, that's when I would ask someone like Dale to help out, because that's not ground I'm trained to tread on, really.
I think the important part of what we do, or our focus with patients in our realm of activity, is to help them understand their choices and understand the consequences. And maybe they have fear about this treatment or what's this going to mean. So we really try to present data to them as best we can in terms they can understand. And there's consequences of doing these things. There's consequences of doing treatment or whatever, but there's also consequences of not doing the treatment. But it's empowerment, I think, and it's making patients aware that they do have choices, okay? And sometimes you don't have to make it right there on the spot. I mean, you don't have to make it in the next 5 minutes. I mean, you can go home and think about it and talk it through and come back and work it through. And you need to make sure they're not making the choice out of some aberrant mental state, you know, like they're not terribly depressed or they're not just had a big dose of pain medicine or something like that. You need to make sure that they're on full speed.